Roll call, please.
Francis Duncanson.
Here.
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 Pam Garvey.
Here.
Tony Johnson.
Here.
William Oliva.
Here.
Rita McKee. Here. Elaine McKee.
Here.
Dr. Ernie August.
Here.
Okay. And with that, I will entertain a motion and
I
a
move to approve the agenda as presented.
second.
Everybody got a copy?
Yes.
We need that amendment.
Discussion, yes. So before we vote on this, we need an amendment. I'm looking for an amendment for agenda item number 8 with the ADRC Meals on Wheels presentation. We would like to adjourn that to next month's meeting with the fire and the Milltown Community Center burning down. That was a main meal site for Polk County, and the staff is scrambling to make alternate arrangements for people there, so they weren't able to be prepared for the presentation today. So we'd like to adjourn that to next month. So Supervisor Garvey.
Can I just ask, is there a way we could just even get just a brief, like how they're bridging right now?
Yeah, Claire, were you able to get that?
I don't need a full presentation, just like, hey, this is what happened, this is what we're doing, this is our emergency plan kind of thing. I just think it would be nice to know it.
Yeah, we can,
Or share.
I think we can have Laura just send that out to the county administrator, who then can share it with the county board members.
Okay, I'm
Present it
just
at-
curious. I've had lots of people ask for like, hey, how is that going? There's things in the paper and I just,
Or maybe even give it at through the administrator's update next week at the county board.
Does the
meeting.
bill have some information that's kind of in your territory?
I don't know. I do not.
Certainly could work that way. Ultimately, no motion has been made, so debate on the issue of the amendments is a little bit out of order, but it's
oh,
fine.
I'm sorry.
Uh,
I
It's, it can certainly be presented either through email or it can stay on the agenda and it can, I guess, be quickly looked at today, I guess, but it's Tanya's. It's not actually Tanya's, it's ADRC. So if no one's here to present, then I
Okay.
don't know who would
We'll
provide.
figure out a way to get.
Right.
I apologize for being out of order.
But were you?
We need to amend the motion then, Joe? Do they need to amend the motion to postpone that to a date certain or?
So far, no motion's been made.
I'll make the motion that we accept the agenda as presented and move the ADRC to next month's meeting.
Okay, because we had a motion on the floor from John to
So are you
approve.
seconding? Yeah, I'll
Okay,
go along with that. And then are you seconding? That
Yes, I
motion?
will.
okay. Is
Okay.
that in order? Okay, good. Okay, if there's any more discussion, no more discussion.
I'll ask that. So
Yes.
there is a Facebook post out on the, for the ADRC of where donations can be accepted. I believe you can go right into their website and they have a donation account set up if there is interest in helping out. But we will get more of the backup plan.
Thank you.
Okay, if there is no other discussion, then I'll call for a vote. All in favor?
Aye.
Okay, opposed?
Aye.
No, motion carried. Agenda item number 4, approval of the minutes for the August 13th, 2024 meeting.
I move to approve the minutes from last month's meeting.
Is there a second?
I'll second it.
Any discussion? Doesn't appear to be. With that, I will call for a vote. All in favor, state aye. Opposed, same sign. And motion carried. Item number 5, public comment, 3 minutes, not to exceed 30 minutes total. Do we have anyone here today for public comment? Does not appear that we do. So we will move on. Agenda item number 6, receipt of information from supervisors not seated as committee members. Supervisor Rowdy or Supervisor Loop? Supervisor Rowdy?
You want her to speak, go ahead. Go up here.
Yep, you can come on up here, Doug.
Everyone,
Morning.
Doug Rowdy, do you need my address or anything?
I don't think so.
Okay. Well, I'm here on a tough subject to talk about line 14. And the reason, two reasons it's hard to discuss it is, one is because it's on the agenda, but I have to speak before it's discussed. So I kind of have to lay into whatever I determine it's about. The second is, no matter which way I go on this, I'm going to offend somebody. So I have to live with that. Deal with it. So I don't know, I hope every one of you has read the Gretchen Sampson letter to the public, or a letter of a public comment. It was sent out to all the supervisors. So if you haven't read it, I hope that you ask to have a recess and read it before 14. So then the other thing that I have heard in discussion is disrespect or disrespectful. So I went home and looked up the meaning of that, and it seems very subjective. So if you're on one side of the aisle, it can be disrespectful, but if you're on the other side of the aisle, you may not think so. So I went back and also, I was at the meeting, but I went back and looked at the YouTube. I have never done that before. Had little problems because I'm not a computer guy, but I did go through it, and I can't see where this discussion is coming up. So that's number one. Number two is, it says, number 14 says possible action. And under action, I looked up censure. And again, that's one, I don't think it fits here, but two, that's going to be really interesting when it comes to Joe, corporate counsel, to discuss that part of it when it gets to 14, because it seems like that's the only action that there can be or discussion that can happen. And one of the reasons I say it doesn't fit here is, as I read through, I've got the definition here, and it's a page and a half of censure. So it's kind of a long-winded discussion of the answer. So it talks about what can be done in committee, but not something that was done weeks ago. So that's one thing to talk about. And as board chair always asks for discussion, and we as supervisors have a right to our opinion, and we give it during discussion. We talk about this supervisor talks, and then he says, is there any more discussion? And if there isn't, then we take a vote. And that's where it should end, because the system works. And in this instance, it did work. And that's what Gretchen Sampson is trying to show. And that's why I think you really should be better. And the reason I don't discuss that so much is because she's covered it so well, I don't need to. So I guess that's where I'll end with this, because a vote speaks what the issue is and answers the questions. So thank you.
Thank you, Supervisor Rowdy. Moving on to agenda item number 7, 2025 budget presentation. Don?
Chair. Oh, that very brief PowerPoint presentation. So I guess I should pass some of these out. Just today, I'm going to be going over the administrator's provisionally approved additional funding requests. You'll see a full presentation on the budget at the board meeting next week. And this is just a preview of some of the items that the administrator would like to see. Capital side projects and some operating lines changed a little bit for 2025. So this isn't a full budget presentation. It's just sort of a list of what Mo's going to bring next week in terms of additional funding requests. You've got the same information in your packet. We've got $5.5–6 million worth of requests, and we've whittled it down to about 2.7. The vast majority of that is capital, about 2.4 is capital, 320,000 is operating. We've got the list of provisionally approved requests from largest dollar amount running down to some that don't even carry any dollars with them. So the big one here is the Highway B project. Close to $900,000 for that. $600,000 allocated for potential grandstand improvement. That is, I should really say is bleachers. That does not include a roof. And so I believe Mo will be bringing to you an option to put a roof on the bleachers, which would make it a grandstand. And that would, I think, be about 500 grand. We're still looking into that. New financial software. We use a product called Financial Edge, and the company that owns that software is slowly degrading it, which makes it tough to use for us to balance our books. It's a program that is basically being turned off by the manufacturer, and so we're going to have to figure out how to replace it. $350 for that. That's capital expense. Patrol deputies. Just a little under 300,000 for that. That's an operating request. That'll be a cost share for us for a few years. So we'll get some support from the state. Assuming we get the grant on that. DC power inverters, that's capital expense. This was more expensive at first and it's really dropped. We had it down at $150,000 and Don's figured out how to get it down to 45. So that's good. And I guess it's no longer in strict order because I just changed that number. Then we've got replacing a recycling skid steer, 80,000. Some new imaging software will get us really tight on our land imaging for 73. Tuck pointing the museum, 70,000. Fran, you had a question about what we're going to do with outside agencies, and I think I responded to that. General government will see what Mo's suggestions are for outside agency in terms of operating. So this is a capital expense. Take care of the museum of $70,000. For the fair, restore a roof, upgrade lighting, and then upgrade ventilation in the admin building of the fair, replace the dock, John boat, web application, and then some wages that are associated with some resolutions that were passed back in the late winter, early spring for environmental services. So that's the list that the administrator is going to bring forward. Provisionally approved means that he thinks these are a good idea. You have control over the budget and you can strike things or add things. If you switch the page over, you'll see we're imagining that colors are going to come from. If you'd advance to slide 1.
Excuse me, Don.
Yes.
I have a question before
Sure.
we go any.
Want to go back, Claire? Yeah.
Okay, so are these the proposed discretionary spending items that will be reviewed at GenGov tomorrow, or is that a separate list?
This is the same list that will be at GenGov and in front of the board on the 17th.
Okay, thank you.
Now, GenGov will also get the outside agencies funding requests.
Okay.
So that'll be at GenGov as well. Any other? Yes.
So the grandstands for the fair, are we still in discussions with the fair as far as them putting some money towards seating of one kind or another? Or
That's my understanding, and I'm not as involved with those discussions as Mo and maybe some even supervisors that are here in the room are. But my understanding is that there's
okay.
Even with $500,000, if we wanted the roof, that won't cover the whole thing. The fair is still in the project for some dollars.
Okay.
Thank you. Any other questions on that list? We'll just switch.
Actually, they started at like 700,000 and he's got it down to about half.
Well, I think it's kind of went up from 700,000 or 800,000 up to 1.7, and that was with the roof. And so we sort of take.
I mean, on the whole budget.
Oh, Yeah, it started at 7 million and you got it down to 2.6.
Oh, yes, sorry. I had my decimal in the wrong.
Figuring that either.
Let's go to the next slide. So, these are the funding sources the administrator is proposing. The vast majority will come from bonding. That's borrowing money, so debt finance. Before my time, Administrator Fry put us on a bonding program where we would keep the expense of borrowing to about little under 2.5 million a year. And ARPA kind of interfered with that. All of a sudden, we didn't have to borrow money for several years. We got a lot of capital projects done with ARPA money. As I've said in a couple of different committees, we're not forecasting any more ARPA money coming in. So to pick up our capital improvement project plan, we've really got to get back on the borrowing program. We're anticipating overall borrowing somewhere between 1.7 and $2.2 million. And the flexibility is really around projects like that roof, the potential for a roof, or potential for another highway project that you might want to pick up. We're imagining borrowing about 1.7 to 2.2. We've got it down here, what we would need to cover these projects. So for these projects on that list, we need about 1.8. We've got an internal loan fund at the county called the 110 Fund, and a little less than $500,000 will come from that. $320,000 comes from levy, $80,000 from the recycling fund for that skid steer, and NA just means that's what the pivot table did. Doesn't mean anything. So that's the total and the funding sources to support it. Yes.
So would we in theory be borrowing money for the grandstand in that 1.8 that we may not be building in 2025?
Correct.
Or, okay.
So we'll need to think through that. So there's some finessing with the borrowing. We can, and some of it has to do with the projects and when the projects might hit. Some of it has to do with what's advisable in terms of borrowing this year versus next year. So there is some complexity out with the borrowing, and we're working closely with our financial advisors at PMA on that. In fact, we have a phone call tomorrow on it. It's a good thing to keep our fingers on. Importantly, we don't have any money coming from the general fund for these projects. So that's a big change over the last 3 years. The capital projects have often come from the general fund, from those ARPA dollars. Any questions about that?
Just one comment, Don, on borrowing, and WJ and about the only one that there was board back then is also along for your time, Don. There was a time there when our bank was loaning us money less than we were bonding from. And, you know, we've got the best bond rating I think we can get. But now I think if we would have looked back 2 years ago, if we'd have done some bonding, we'd have got more for our bucks, and because of inflation, and that's the reason why we got to be looking at restructuring that now.
And we will look at private placement money in addition to the markets. So we will look at bank financing in addition to bonding. And our advisors will help us make that determination based on
Thank you.
all sorts of things, including rates.
Appreciate that.
Yes, sir.
So if my memory serves me right, at the last meeting, I mean, we have our 50% reserve that's set by the county board. And then there was like $4.6 million that was committed but not spent. It might be on a road, it might be on a building, whatever it is. It's allocated to go somewhere. Is that part of the 50% or is that over and above the 50%?
That's above the 50%, sir.
Okay.
Yep. And I should note that the auditors will be with us at the board meeting next week and walk us through the audit. And we'll get a sense of what our remaining uncommitted balance of the general fund is.
You think the auditors will have any recommendations for it? I like it when they do, and sometimes they do, and sometimes they don't.
My experience is that auditors are resistant to providing advice. They can tell you if something is an absolutely terrible idea, but I think that they'd like us to make our own decisions. We have a wonderful relationship with our auditors, and they do provide us, they give us guidance on important operating issues. For instance, we'll be looking at how to structure the recycling center, whether it should remain a department or be an enterprise. And they've given us some good information on the pros and cons of that, different counties. So we do get advice, but it's generally, here's how it would work this way, or here's how it would work this way. And almost never, you should do A versus B.
Nice to have the options.
Any other questions or comments or remarks for Don on his budget presentation? If there is not, we will move on.
Thank you.
Do you want to stay for the?
Oh, I'd be happy to stay for the housing.
Okay. Our next agenda item then is an update regarding housing.
I wish I had some information for you on housing, but I think we're still working on the contract with Amory. I'm not aware that we have any new applications. They come directly to me when they come in. I think it would, like this program, it would be good to work with our municipal partners to try to develop some additional interest in using the remaining balance of that program. We did have a request a few months ago from an interested party in Amory, also in Amory, about whether the program could be used to fund projects that were initiated by school districts. And we did not answer that question at that time. The resolution is not worded to allow that, but it is an interesting idea. And I'll just put it out there that if that's something the board had enthusiasm for, you could change your mind on the wording of the resolution if you thought that would promote workforce housing for teachers. But that's all I've got.
Any questions or comments for Don on housing? No? Okay, then we'll move on to agenda item number 10.
It's to go first.
Oh.
Youthful disease. So we had an interesting August. We had 2 bat tests positive for rabies in Polk County. And then last week we had our first case of West Nile virus in a bird that was found. So with that, we've done some press releases, again, just encouraging the public regarding rabies. You want to stay away from any wild animals, encouraging people to make sure their domesticated animals are vaccinated, that kind of information. And then if there's any bite to a human or any bites to pets, please report that to the health department and we will help you step through those next steps. As far as, do we need to do testing? Is there quarantine involved? What does that look like? And then regarding West Nile, our messaging is we want people to be just aware of mosquitoes. So remove any standing water, any places that would harbor mosquitoes. Consider maybe not going out at dusk time when mosquitoes are most active. If you're immunocompromised, take that into in consideration too. So in addition to those cases that we were dealing with and sharing that information, we just had a handful of enteric, more like E. coli cases come through, not related to any specific event, but typically this time of year we see a little uptake in those. We've had 5 COVID-related hospitalizations in the month of August, and just a handful of STIs also.
Thank you, Helen. Okay.
Excuse me. The testing of these birds now, they were birds that were found dead and then we had them tested.
Yes, so a vet sent it to the state lab of hygiene to be tested. The results came back positive, so the vet found out that information, but then because it can be related to humans also, the public health department got that positive test result too, just so we can share the information. There is no like human cases of West Nile and Polk.
I had some people call on that. So
Any other questions or comments or concerns? No? Anything? Ernie, do you have anything for us this month?
Yeah, I think that the mosquito thing is kind of scary because we just had a friend who had some kind of, I don't know if he had triple E, which is encephalitis, Eastern equine encephalitis, something called a Jamestown variant, and he ended up not being able to walk or talk for about 4 days and ended up in a region that is not fully recovered. Well, he's still recovering, but so I think mosquitoes are are much more dangerous than we realize. And so I think we probably should be using some. The second thing I had was people should be encouraged to get their shingles shot because there's 20% risk of long-term infusion and memory loss. But get the updated shingles vaccine. And I think the Lyme disease is still here and present. And it's a much higher rate than is actually reported. There are now 3 new updated vaccines by one of the vaccines is 12 years and older, the other is 6 months and older. And then there's a Novavax vaccine that was released August 30th by the CDC. So that we're still recommending people 75 and older get 1 dose of respiratory syncytial virus. And I had mine in January, and adults 60 to 74 at increased risk of illness, chronic heart disease, lung disease, immunocompromised. And I know that one of the concerns we're seeing now in Minnesota has had 30 cases of measles.
Wow.
And these are in unvaccinated people. And so Twin City Television the other night had the measles vaccination rate in the Twin Cities is 87.4%. But there's one subgroup of immigrant population that is only at 24% because they have been told that measles contributes to autism by this infamous doctor who I forgotten his name. And some of you may know who that is. And anyway, he's been totally disproved. And he's lost his license in England, but he still goes around the world promoting this lie. And so I would counter that. And I know there's a number of people in Polk County who don't want to vaccinate their kids for religious reasons. But we have to remind them, that we need 90% vaccination rates in order to have herd immunity. And the other thing is, none of these people are going to be able to get into any health profession unless they're vaccinated. Sometime along, they can't get admitted to the University of Wisconsin-Madison if you're not vaccinated. And so I think that it behooves people to really understand that these are life-saving things, and so it's important to make sure that we're up to date on our vaccinations, immunizations.
Thank you.
And unfortunately, I think this doctor has spread that word nationwide, not just.
Yes,
It's
worldwide.
Worldwide.
Yeah, he keep going around and.
Are there any other questions or comments for Dr. Lagus? No. Okay, with that, we will move on. Agenda item number 11, division update. Tanya.
I will add for the measles update that we have been in contact with all of the schools. That's typically what our population is going to be for vaccinated. So we have plans with schools in case we do get a situation where there is a positive case, and one positive case does require action. So we are all set for that. We've got the numbers of of kids who are not vaccinated for whatever reason or have not submitted their vaccination record. So we are prepared for that. So this, I will be giving you just the Community Services Division update. I need to apologize in advance. You're going to have to bring out your acronym spreadsheets that we gave you guys back in your orientation, because there's a lot of acronyms on this. So maybe a little bit of a quiz for you. So I'll start with behavioral health. I think the good thing to report, and I'm not going to read this to you. You have the handout. You can read it, ask questions later. I'll just point out some key highlights. We have eliminated wait lists for 2 of our major programs, and that is a huge celebration and victory for those units, because that means that we're serving people, and it's just a good thing all the way around. We're not really allowed to have wait lists in some of those programs. So we've been tackling that for quite some time, just based on the amount of demand in the county for those types of services. So good job to those teams. The children's long-term support waivers, we also, that's another waitlist situation where we are not, by 2025, the state will be monitoring our waitlist status, and we are not allowed. So it's one of those, when the request comes in, we need to evaluate and determine services if they are eligible. They've both Birth to 3 and CLTS recently underwent their Metastar reviews, and I believe that they were satisfactory. Bill Oliva had requested a report later for that team to come in and give you more of a report on what that looks like. So we'll bring that in a future month coming up here. So with on the other side of behavioral health, there's 3 sides to behavioral health. We've got adult protection and crisis services. Things are holding pretty steady with adult protective services. The majority of our investigations are financial abuse situations, which is pretty common. I think that's the popular type of, or most common type of case that we would investigate. The self-neglect and neglect, typically we find that they just are not connected to services. And once we step in, get them connected, those problems resolve. Crisis services, we've had 27 emergency detentions. 19 of those went to Winnebago Mental Health Institute. 17 went to Amory. So we're glad to be able to use Amory. It's right in our backyard. We'll be giving the ad hoc committee update maybe next, a couple agenda items down. 4 of those went to Mayo and Eau Claire, and then 1 went to Mendota, and we are actively trying to get that person back home here. Mendota is just kind of an anomaly. We just don't typically place in Mendota. That's in Madison. So the behavioral health unit, we have our psychiatrist remains active with 173 consumers on this side of the street. Over in the jail, he provides services over there. They've got 13 active Polk County inmates. And then the mental health and substance abuse, we've got 156 active consumers. 70 of those are in the intoxicated driver program. So that's once they've received an OWI, DWI, they come here for the assessment, and it's determined if they need to or follow up with treatment services for that infraction over on the law enforcement side. We are partnering with AmeriCorps to bring on a recovery coach. That's just in the initial stages right now. So we will house that person. His name is Jared Norlander, and he was doing it through a different grant. We were just able to pick him up so he can carry on services. He's started his training here on today, and we'll be offering services 8:30 through 8:31. So we've got them for a year, and we're using one of our block grants to pay for that. So we have a $6,000 match. The rest of it is paid. So that's a really cool way to use some money to get some more services too. Very little bit of money on our part to get those services out. We are in full force with our QA processes across the division. So we're really looking at the services we're providing and doing some evaluation on making sure that they meet the criteria for the programs that we're claiming them to, as well as making sure that what's in the content of the notes and how we're reporting it will reflect the amount that we're billing. So QA across the board, That's going well. In economic support, they just went through their management evaluation review. That happens, is it every year, Diane, that happens? So that's for the food share program, formerly known as SNAP, so the Supplemental Nutrition Assistance Program. So they have areas of focus for the MER, and we actually had 2 secret shoppers call our shop here, and they had outstanding results. So Zoya and Kimberly in the Economic Support Unit were mentioned by the state in that MER review saying, fantastic job. So good job for those guys. They also pulled sample cases to make sure that there were no errors. And Tiffany and Emma were the 2 who their cases were pulled, and they also got outstanding remarks. So good job to them. DCF. So we have been keeping you apprised of out-of-state placements, high-cost placements. We know they can be detrimental to the kids and families as well as to our budgets. I just had them report on what's happening with some of those kids. We've got 3 of them have returned home from out of state, and they put the costs in there. In state, we've got 1 that's returning home. It seems like we always have 1 or 2 in the hopper. So, they come and go. So we're just keeping a real close eye on that. I'll report the finances in a minute. We are also full force working with doing some things with Northwest Guidance to try to alleviate some of the need for the out-of-state and the higher dollar placements, as well as Lutheran Social Services, and then some local contracts too. So trying to stay on top of that and avoid the out-of-state stuff. Do you have a question?
Just a quick question. When you say returned home, are they placed back in their homes? So they're done with treatment? Or are they returned home, they're back in Polk County or back in the state?
They are one of those.
One of those, any of those. Oh, okay.
Yeah.
I just curious as far as returned home. I mean, so they're, okay. It can
Sometimes
be
they
above.
come for, like, they do a step down, so they're gonna go to a lesser restrictive, and then with the eventual plan,
Sure.
they either go home or to a foster home or something.
So, but that could be any of those when we
So,
say
yeah, so they're always trying to get them,
out of state anymore.
always trying to get to the least restrictive. So that's, yeah, they could be on a step down or whatever.
Absolutely. I just, when we say returned home, it's just, they're not out of state anymore is basically what that means.
Correct.
Yep. Thank you.
Yep. So public health, flu shots available October 1st through the 19th of November, Tuesdays from 9 to 12:30. And those, is it still the underinsured or uninsured populations, or everybody can come?
Everybody can ask for insurance.
Appointments are,
Yep, so call our 8400 number to make an appointment.
they are appreciated.
Yes, please.
Maternal child health team, they're bringing community groups together to discuss strengths and gaps of local resources for pregnant, postpartum, and parents of young children. So that's moving along really nicely. We are looking at completing alcohol compliance checks this fall with our municipalities. And we'll be doing that assessment of on and off sale liquor. So that means this year we're going into bars. We've never gone into the bars before, so this year we are going into those bars. Reproductive health, they are supporting some human growth and development curriculum in 1 school district so far. We've offered it to all schools. There's definitely been some interest in us coming in and do it because that's a topic that nobody really wants to talk about. So if our nurses are willing to do it, they're going to let us.
I'm sorry, I have a question. Can we back up
Yeah,
just
sure.
a little bit? This is the first year for compliance checks that you'll be going into the bars, you were saying. Do you have any support for safety reasons from law enforcement when your staff does that?
Yeah, so this year we're doing it a little bit differently. We'll have a public health generalist being the main person, and then we're requesting assistance from the municipalities to go into those. As far as if they're not in a municipality, I don't know if we just won't be going into the bars if it's out in the country or not with municipal help from the law enforcement.
Okay, thank you.
Yes.
So what's the repercussions if somebody sells?
So that depends on the municipality if they will offer issue citations or not. If not, then we send them a letter saying, hey, this happened. You really need to look at your clerk selling to minors.
Can affect their local license.
It can.
We also send that information, we collect, how many people did not sell and how many people did sell. And that information goes out to the owners too. So they just know like, hey, congratulations, your employee did not sell. We also send that information to the municipalities also just for, so they're the licensing folks. We send it out for their awareness, what they choose to do with that information.
So just to clarify then, so you're actually going into bars to see if they'll sell to minors. So how, I'm just curious, usually is that not a function of police departments?
No.
I know in other counties it is, or other
Always-
cities I've seen. So I'm just,
It's always been a partnership. So we've got the grants to do the compliance checks. We find the kid. We send the kid in, either our employee or the law enforcement person is sitting out in the parking lot there to back them up.
okay, interesting. Thank you.
Okay, pardon that interruption.
That's okay. And then the Lionheart experience is being offered to districts again. It was a very popular presentation. We've had the person here a couple times to give that presentation, and it's backed by popular demand. Using that. Medical examiner numbers, it looks like Jamie's done 188 cremation permits so far this year. Is that on track to be higher than the year before? It typically is higher than, because that's just the trend.
Yeah.
93 coroner scene investigations and 18 forensic autopsies, which seems high to me if I can
The autopsies are
remember
high.
the invoices coming through last year. It's higher than it has been.
Invoices or the autopsies are high. Last year we had capped at 25 and I'm expecting with this trend to be within around the 30 range.
And the autopsies come directly out of our budget.
I believe.
Yes, they
Yes.
do. As long as she's ordering them, they come out of our budget. If family requests them, they can pay for them.
And they-
Yeah, we don't provide private if it's something that, say if it's a natural death with significant medical health history and if they're over the age of 65. If it's something that family just wants to find out which specific disease process caused the death, then we'll urge them to order a private exam. Paid for by them. Genetic testing is also covered by family as well.
Unbelievable part of our budget we have no control over. It hurts.
Do you have any inkling or any comments about why the numbers are higher this year?
Nothing tangible, more trends, I would say. There have been we have had more complicated autopsies this year. Such as an infant death earlier in the year that required a cardiac pathology report that required extra work. We've been seeing certain deaths that have had multiple mechanisms of injuries around the time of death that we need a forensic determination on from a forensic pathologist. We've also seen more car crashes with charges pending from the law enforcement side. So just as is, if there's charges pending, then we do have to do extra work. And at that point, if we're sending for a forensic CT scan versus a forensic autopsy, the CT scan costs as much as the autopsy without the added toxicology testing. So typically, if there's charges pending, then we have to pursue an autopsy to make sure that we have good documentation that includes law enforcement side as well as insurance side. So just as it stands, this year in particular, we've had a lot more, I would say, complicated cases. We've had a homicide in the beginning of the year. We've had things that just aren't regular. So that has caused more autopsies. We've also had a lot of our population within the 50-year-old range that just don't like to go to the doctor. And we need a solid finding for that death certificate since the state of Wisconsin will reject natural causes. We need to have something specific. So even if it doesn't appear that there's anything non-natural going on, if they're under the age of 50 and if they're under the age of 60 and there's no established medical care, we need to send for a forensic autopsy to get some sort of natural findings for that document.
How many suicides do we have? That's
This-
also a big cause.
This year, I believe our suicides are, I would say, around 5. It's been tricky. We've had a fair amount of deaths with very extensive medical history with illicit drugs on board. That's kind of been the trends that we've seen, as well as accidents are high. We've had, I believe, 3 or 4 deaths that have been true overdoses where there have been nothing else involved, and the death certificate has been signed accidental due to illicit drug overdoses.
Yep.
We've had one undetermined that required some extra work, but it's mostly been accidents with charges pending. That's been what we've noticed, especially this summer. Whether someone didn't follow the rules of the road or someone fell asleep while driving and collided with another vehicle. That's what we've been seeing. That's what we've been seeing, especially this summer. Have been accidents.
So on that note, we are applying for a grant through the Department of Health Services for an overdose review team, which will be part of Jamie's office, public health. There's law enforcement representation, a couple others. We are doing the overdose, we're rolling in suicide and child death. So we'll have one death review team if we get the grant to look at those types of deaths that Jamie is speaking of. That deadline's coming up here soon, like in a couple weeks. So we're working on that. The 2 deputy medical examiners are enrolled in a death investigation class. Once that's complete, they will be certified in death investigation. And then we are working on a policy for unclaimed remains, and that will be taking back a cemetery plot, an abandoned cemetery plot, and then getting a headstone for that and like what that process entails. Because that also is a trend now, is that people are not claiming their loved ones once they have passed on. So as far as business services, I'm just going to report on things that pop out for us when we're monitoring our budgets. Currently in behavioral health placements, placements are what will kill our budgets all day long. So we are currently sitting at 78% of our budgeted amount for 24 in behavioral health. That includes Winnebago group homes, adult family homes, the Mendota that I mentioned, when we are the responsible party. And then the Department of Children and Families, we've been keeping a closer eye on this one and reporting that to you as well. We're currently at 101% of our placement budget. So we're sitting at over budget. We should be at 58% if we're staying on track through the end of July. So I guess the note on that would be that, we don't have a carryover fund. That general fund is what covers those mandated services. So we already know that we will be asking for general fund to cover the placements in at least child welfare, possibly behavioral health, because of the need for the mandated services that we're providing. For our 2025 budget, we did go down in our levy allocation a bit, was it a couple $100,000, was it? Do you guys know? Sherry, maybe?
That's a bit.
A little
It
bit.
was the same.
We stayed the same.
Our levy stayed the same.
Thought it was 150. Anyway, we ended up getting creative because we knew these are trends for us. We shifted things around. Last time I reported that we are moving some positions around. We're not filling some positions. That money is all going back into covering these, so we don't have to go to the general fund, but in the event, we are going to be going to the general fund this year.
Okay. Is there any other questions?
Supervisor Olson.
Let's back you up to the grant a little bit ago that you were speaking of.
Yes.
All right, what did that cover again? Drugs and accidents, you said?
Overdose, fatality, suicide, and child death. That's what we are focusing on.
And so what's the goal when we're collecting this information, I guess?
Do you guys have a,
Yeah, so the goal of any death review committee is to look at the cause of death and then backing it up to see what services was that individual connected with or not connected with, and how could we have done it better? So how could we prevent the death from occurring, and what should we be implementing for prevention for other deaths in a similar manner? And then also, how are we collecting that data? So are we collecting the right information? Are we highlighting the trends? Are we recognizing the trends in our community? And then what are we doing to get ahead of the trends? To avoid suicide deaths, child deaths, and overdose.
It also provides documentation for review. So my experience with being around the Infant Mortality Review Board, it allows investigators in medical examiner's office to really take a hard look at how well their employees investigate these deaths, such as asking questions about reenactment photos, documenting the scene, finding out if this was something that could have been environment versus medical. So it really does allow, not just for the data, but it allows the medical examiner's offices specifically to just have that chance to review how that investigation was done, make sure our data is good. If the first time we do this review board, we notice that there are gaps in our reporting system, we notice that there's gaps that our medical examiners or deputy medical examiners aren't asking the right questions or getting the right medical records, then the next time that these types of deaths present, we can say, okay, we know that these questions are going to come up in the future. This is going to be the information that we have to get. So it allows the medical examiner's office to really kind of take a good look at how they investigate deaths as well, and that's beneficial.
Couple of comments. I wasn't very clear on the new COVID-19 Pfizer mRNA vaccine is 12 years and older. The Moderna vaccine is 6 months and older. And 2 weeks ago, the government announced that there will be free COVID tests again available. I'm not sure what the mechanism of that is going to be, but anyway, they're going to be available for people to test themselves for COVID.
Good to know. Thank you for sharing that. You have anything else? No?
So if you have any questions, just let me know. You can email me, call me. I'll be happy to answer.
Okay, thank you, Tanya. Okay, with that, item 12, legislative event report. Do you have anything for us, John?
Yeah, we got a lot of things happening right now. September 22nd is our annual business meeting at the Lacrosse Center in La Crosse, Wisconsin. Here is our agenda. Mark O'Connell is our president and CEO. Of course, as you know, this is a what we'd call a lame duck section, being some are new people are running for office. Going through the resolutions, I think the only thing that I saw affecting Polk County, like I say, there's not a lot of them this year because it's midterm. Langlade County has got a resolution opposing COVID-19 mandates. So that's something that can affect like our committee. So I'll be interested in voting on that one. I think another one is from Monroe County supporting housing for homeless veterans. Homeless is always part of our committee, and last year I introduced 5 resolutions. They all got sent on without any dissension. I had complete support on that. And the way this system works, so when we have a resolution, then it goes to our whole committee of officers, and then it goes to the legislature. And I can't thank Gay enough for like the resolutions last year. She's the one that carried them to the legislature. And then unfortunately, we have a Democratic governor and a Republican House and Assembly, and I think we got most of them passed, but the governor unfortunately vetoed about 1,200 resolutions. So outside of that, our business meeting, I have reports here on the audit, financial report, our Johnson Counties Association is strong. I'm in touch at least every month or probably every other week or something from some of the towns or some counties or something around on, so I'm in touch with the CEO or every month on, there's always something coming up. So I'll give you another report next month after the convention on what we passed and what we didn't pass.
John, did you say that meeting was the 22nd of September? That's a Sunday.
And that is the same day of your big
Well,
day.
I know, but I mean, it's a Sunday. Their meeting's on a Sunday.
The meeting is Sunday, Monday and Tuesday.
I
But
see.
our business meeting starts at 3:30 on Sunday.
Oh, yeah.
And we vote on all the resolutions right away on Sunday. And
Oh,
I
interesting.
think that's a little bit unfortunate, but that's the way it is. I don't see anything on, we got executive rules and reports from the president and the resolutions is a big one, and that's what I'm involved in.
Thank you, John. Thanks for all your work you do on those things as well. Do we have any questions or comments for John about his report? Doesn't look like it. So with that, we will move on to agenda item number 13, our ad hoc committee report. Tanya.
I like standing at the podium today.
Yeah.
Don Burrows is on. He's been my partner in crime for the ad hoc committee. We have a subcommittee that's been working on some more short-term solutions for the crisis gap in services here in this area in western Wisconsin. We've been meeting with the 4 counties. It's Polk, St. Croix, Barron, Chippewa, to figure out how we can get some interstate compact going with the Minnesota states. We had a very hopeful meeting last week with one of the hospitals over in Minnesota. St. Croix County does have a contract with them, and they just found that they have a 2024 contract with them. We're hoping that that's the door into interstate compact. Once we get them on board with our contracting process and our rules, because Wisconsin rules are much different than Minnesota rules. Ours are a little more strict, I guess. There's a little bit more work involved in actually having somebody in a detention in one of their beds compared to what happens for a Minnesota resident. So we're very hopeful that we can get some contracts going. We will then connect with the secretaries of states, both on Minnesota and Wisconsin side, to get their blessing that we can do these out-of-state placements for emergency detention purposes. So there's some hoops to jump through, but it seems like it's not going to be as complicated as we thought. Yes, and then for long-term, obviously, we want some more of a permanent solution. I don't know if the interstate compact will be one of those permanent solutions, but definitely got the ball rolling in the right direction.
Supervisor Olson, did you have any comments?
No. Are we still meeting after this meeting, Tanya?
I don't know. Don, are we meeting after this meeting? For them?
Me and Jay were having this in the hall before the meeting.
I was not aware that there was a meeting that the administrator would be attending today, but I can make that.
We can touch base for sure after the meeting if you
Okay.
guys would like more information. And I think Don Burrows will probably come over. Don, will you come over?
Yes, I'll be over right after the meeting.
Okay. Anybody have any questions or comments for Tanya? Read it.
No.
No? Anyone else? And with that, we will go on to agenda item number 14. As chair of this committee with Corporation Counsel Loso's opinion weighing in, I would just like to set some ground rules for this. We are going to watch the video. Each committee member will have 5 minutes to give comments. We will time that. After everybody has had one chance to speak, if they would like to speak again, they will be given another 5 minutes to speak if they would like to. I will not be making any comments. I will not be answering any questions. This is not a quasi judicial hearing of any sort. It is my hope that when we're done, this is the end of it and we can all move on. And there will be no attempts to illegally retaliate against me for expression of my First Amendment rights. So with that, roll it, I guess.
So we don't want to watch this in its entirety.
That I've written, it shouldn't take more than a few minutes. So just, okay.
Go ahead.
Okay. So discussion, I'm just going to just read a statement that I've written. It shouldn't take more than a few minutes. So as chairman of the County Health and Human Services Committee, I have some comments regarding this agenda item. You know that the current citizen members are Bill Oliva, who we just approved, Dr. Arnie Lagus, who has not come up yet, Sabrina McKee, who we just approved, and Sabrina Meda. So Sabrina works as a registered nurse practitioner. She has a doctorate degree in nursing and is currently in practice at the Cumberland Clinic. She's a Polk County resident of the town of Kinley. And then Dr. Arnie Lagus, I'm not going to introduce because most of you probably know Arnie from his years with the Sacred Medical Center. These people have all expressed interest in continuing to serve on the committee, and I don't see any reason to make any changes at this time. A concern that was brought forward at the last county board meeting about staggered terms has been addressed. The county took that under advisement. They corrected that, so the terms are staggered as appropriate. As the chair of the Health and Human Services Committee, it's my responsibility to define meeting procedures and work with other county officials and committee members to accomplish that. I want to be clear that I express my appreciation and my thanks to Brian, who was here tonight, and also to Gay for their interest in serving on the committee and their commitment to public service. I don't support Gay's appointment to the committee, and I'll state the following reasons. Health and Human Service citizen members are non-partisan positions. Well, and that's something Gay isn't exactly known for. We have a big tent and we have room for everybody's opinion, and we want to celebrate freedom of speech. We need to be mindful that we're here to serve all of the citizens of Polk County. At last month's board meeting, several of our county officials expressed concern with various county board members, citizen members, and officials expressing concern about them attending meetings virtually. Gay has another 6 months to serve in the assembly. And then it's my understanding that she possibly will be wintering out of state. So in-person attendance is going to be an issue, whether or not she's going to be able to attend in person. And as the chairman of the committee, if she is on the committee, I guess we'll have to address that. Our county administrator has made comments about political pressures from citizens to appoint her. What concerns me is there seems to be amongst some people somewhat of an expectation that we're going to displace people who are better qualified and longtime committee members because a partisan politician is suddenly interested in serving on the committee. I'm not trying to pick on anybody, not trying to pick on Gay. I just don't think it's appropriate to have a sitting state representative of either party, of any party, sitting on a citizen committee, no matter what their party affiliation is. I did speak to Malia about incompatibility of office statutes. but she was kind enough to clarify for me, and she does not feel it applies in this case. You know, we have a good team of knowledgeable, nonpartisan citizen members who work well with each other. They work well with the county board members who sit on the committee. They're very dedicated to health and the welfare of the citizens of Polk County. They guided the county through a global pandemic and advised on many topics such as smoke-free air, mental health, addiction, harm reduction, and child welfare. So my statement tonight, in my opinion, is to let them continue to serve and do their job.
Any other comments? I have one.
Okay, so we,
Madam Chair.
yes.
Just before we get started, my job here obviously is as the attorney for the county. As a committee, you are an extension of the county. Before any discussions started, I wanted to address what potentially this can result in, which would be some sort of action. I want the committee to be aware that I received yesterday, it was sent to me Friday, but I received yesterday a notice of potential claim against the county board. As a result of that notice of potential claim, my advice to the committee today is, because I have not had substantial time to look into the issue, I've not had substantial time to review whether or not the claim would be valid. I've not had substantial time to come to a formal opinion on the merit of the claim. My recommendation to the committee would be, after discussion, no formal action be taken today, but rather, if formal action is deemed to be the will of this committee, that it be set for next month's agenda so that I can have an opportunity to look into the validity of this claim, look into the merit of it, and then subsequently advise all of you on the potential ramifications of your actions. What I would not like to see is any kind of decision here today that results in litigation against the county. I would prefer to avoid that at all costs, all the time, obviously. And so as a result, that is my recommendation to the committee. Obviously, you're all here as voting members. You can do as you wish. You don't have to follow my recommendations, but that's my recommendation for today. I can say that I don't believe the litigation is with merit. I don't believe that there is any validity to this supposed claim. However, it is important that you be aware of it. And I think it's important that I have time to look into it so that I can more fully advise you on your decision making. So. That.
Question for Corporation Counsel. Is that claim public knowledge?
Ultimately, any notice of claim sent to the county would be public information if anyone wants to. I believe it was also distributed to all of the county board members. So I don't have control over any claim that is sent to you.
So it's public knowledge.
It would be a public document if it was requested through the open records request process.
So who is bringing the potential lawsuit?
Tell you that the potential lawsuit is brought by Chair Duncans.
So I guess I'll try to, I'm gonna, go ahead, John.
I don't know anything about this. I don't particularly do email. I think some of these things and I'm better off neutral. And so I don't know anything about this. About this claim, so I'll have to study that. I've sure got a lot of comments from a lot of people on it, and I'll leave it at that.
I just have a question for corporate.
Supervisor Garvey.
Thank you. Question for corporate counsel. And I'll admit, maybe this is a dumb question, but deciding to not do anything, and as Chair mentioned earlier, we'll have a discussion, be done with this, is that also considered an action?
I would opine that if this committee decided not to move forward with any kind of action, ultimately the action would be not to put it on next month's agenda. So if the committee doesn't want to put it on next month's agenda, that isn't any action that I believe would rise to any kind of litigation.
Okay, I did,
Be-
you know
would
what
be
I
my position.
Thank you. It's like, because anything we do is an action. So what is thank you.
I can clarify disciplinary action. I
Thank you.
suppose would be
Thank you. I
the-
appreciate that. Okay.
And the question for Corporation Counsel also. So seeing as though you don't want us to take any action necessarily one way or the other, and it's a public document, are we better off waiting to discuss it next month where everybody in the room who sits on the board, John, the citizen members who didn't get it, can look at what the potential litigation says?
So ultimately, your discussion that's on the agenda today is set for discussion on what was in that video. I would say if you want to have a discussion on what was in that video, you have every right to do so. It's noticed. You can absolutely do that. If you want to have a discussion on what is included in the litigation notice, you'd have to notice that
For
for
next month.
next month. Currently, again, I was giving you notice of it so that your decision related to this particular issue can be made with all the information you need. We are potentially diving into talking about something that's not on the agenda, if that makes sense.
No, makes sense. Just ask you.
Just a comment, not a question for you, Mr. Lewis. And I'm going to comment on the video.
Okay,
That's where my comment is going to go.
okay. Any more questions for our corporation counsel on this? No? Okay, then we're going to move into the discussion of the video. Member Oliva.
Just jotted some things down. I think everybody has a distinctive interest in sharing what we think with others. Everybody develops conceptions and forms judgments by talking through the matter with others. Such encounters offer opportunities to tell others what we think so we can learn from their feedback. Everyone knows from their high school social studies class what the First and 14th Amendments are. I think even Pam can remember that because I think I taught her that. But there are limitations. We have thousands of court cases over the past 200 years limiting what is said or what is expressed. And what is expressed can be a slippery slope. We all know that. Follow national politics. What is defamation? What is slander? What is derogatory? What is insulting? What is offensive? What is malicious? What is disdainful? Everybody has commentary. Censure, reprimand, removal, all have definitions. Choosing an adjective is easy based on one's opinion of what the listener heard. Speaking candidly sometimes makes people feel uncomfortable. And I'm sure some of you feel that way now. What is the role of this committee? What is the role of this committee? Tanya provided that for us during orientation. There are certain things that we can do and certain things that we can't do. I've gone through the state statutes. I am not an attorney. My master's degree is in law, however, and I get myself in trouble an awful lot. We can appoint, recommend, prepare, advise, develop, comply, and assist. Those are the only things this committee can do. Period. The policies of the county board provide removal of a chairman or vice chairman. That's the only thing I could find in county policy. I have not found anything on subcommittees, ever. I respect the comments that came in from Gretchen Sampson. She worked for this county for 41 years. I had the pleasure of working with her for 41 years. That tells you how old I am. She started as a school nurse at Unity and then progressed to this county to become a supervisor and a doggone good one. My opinion is only one person on this committee. And I respect what Mrs. Sampson said, and I agree with what she said. I also agree with what Mr. Rowdy said. This committee appoints, recommends, prepares, advises, develops, and complies and assists. That's it. The county board and the supervisors that are elected make other decisions based on what corporation council and state statute says. That's all I have to say.
Dr. Lagus.
I echo his comments about Gretchen Sampson. I also worked with her for a number of years, and I think that we should all read her recommendations. That there's a certain amount of everyone has a right to express their opinions and without any malice or any kind of thing. So I would urge the this committee and the county board to keep Francis Duncanson as the chairman of this committee. And I'm sorry I have to leave because I have to take my wife to a medical appointment.
You're excused. Thank you. Okay, with that, other comments? Any other comments from anyone? Going once, going
I
twice?
just had 3 hands go up. So.
Okay, so.
You want to
Supervisor-
start, John? You want me to?
I'm looking at things, I've been on the county supervisor for, I guess, 22 years, 21. And this is completely new as far as any accusation against anybody. I don't, like I say, there's been discussion. We have a tremendous responsibility of respecting everybody by name and by reputation. And in my 22 years, I've never heard any accusations of anybody. I don't know of any chairman or supervisor or anything that's ever had any opinion. A code of ethics to me is everybody's opinion and reputation by respect. And I'm just shocked and just completely dismayed and shocked that there's any opinion as to how anybody else should vote at any kind of a meeting. I've just never seen it before. And I think we got some things here to consider, respect of ethics and reputation and accomplishments. And Gretchen Sampson is the person that I work with daily on a lot of times on conditions and things that came up, but that has no bearing as far as being on how we should vote. We need to look at what's on top of the table here, the things that have been said, the things that we've seen, and I think that's our responsibility.
Thank you, John. Other comments?
So I really have no dog in this fight, even though it may seem like I do, having brought this to the agenda, other than bringing what was said at the county board to light to the citizen members of this committee. I do not care if Francis Duncanson stays as chair of this committee. It does not make any difference to me at all. What I care about is how we play the game. And if we're going to play the game, that I can insult the county administrator and insult staff, I'm okay with that. My goal in all of this is to understand is how this committee, as well as the county board, we play the game. I will play the game however the rules are. If the rules are that I can accuse the county administrator of caving to political pressure or anything else, because that's my free speech, of which it is, I'm okay with that. But I think then we need to understand the possibility of that things get really, really ugly in Polk County because it's my right to insult somebody or accuse somebody of something. It is a dangerous road we are going down here, I believe. Like I say, the outcome of this matters none to me. What matters to me is how at Polk County are we going to play the game? Are we going to play it with respect or are we going to play it with accusations?
Supervisor Garvey.
Thank you. So I spent some time rewatching it, thinking about it, and I do really appreciate some of Bill's comments. I've actually stolen some of them because I think they're really important. Civil discourse is incredibly important. It is what we are based on. It's part of free speech. It's part of respect. It's part of listening and learning, as Bill even alluded to. And as I re-listened to that, there were two statements that that struck me. One was, when Bill even, crossed over into slander or accusation or assumption. One of them was, as chairperson is, if she's on the committee, we'll have to address that as far as if she's here personally, in person or virtual. But I also feel like that is why we addressed the whole point of these are the rules of the meeting, and we went over that at last month's meeting. So to me, that's been addressed. We addressed that question. She brought it up. It's been addressed. We understand the rules of the expectations for the meeting. The second one was what Brad mentioned as far as, and again, it ties back into what is slander versus what is civil discourse. Stating the county administrator folded to political pressure or implying that. However, later on in that video, Mr. Norby also had the opportunity and did say that he did spend time, and part of his job is getting information from all people and hearing things from all people. And he took a lot of that into consideration. So I feel that also that was able to be addressed. So based on all of that, I think we would be doing a huge disservice to move in any other direction other than we address the fact that civil discourse is important. We understand that we always want to be respectful of everybody's rights in their personal dignity, and let this go and move forward.
Any other comments? No? Okay, if there are no other comments, then we will move on the agenda. Subject matters for our next meeting on October 8th. So we have identified, hopefully, that ARDC will be able to give a presentation on Meals on Wheels. Okay, did the committee want to bring forth any more next month on agenda item number 14?
Metastar review. Metastar. We'll do a report on the Metastar review.
Metastar review. Okay. So if I guess I'm still a little unclear. Agenda item 14, if somebody wants to bring that back next month, I'm going to ask you to make a motion to do that. If not, then we're done with it. Okay, looks like we're done with it then. Okay, any other subject matters for the meeting next month? No? Okay, with that, I'll entertain a motion to adjourn.
So
Adjourn.
Second.
Okay, and we are adjourned.